October 29th is celebrated all over the world as World Stroke Awareness Day. Stroke is a leading cause of disability in the world today. It is expected to increase in numbers over the time due to various reasons. As such, 100 to 120 people are getting affected in 1 lakh population. That is the disease load we have today as far as the brain stroke is concerned. Going forward, the numbers are going to increase due to various reasons. Usually stroke occurs after 60 years, but after the COVID, the number of young strokes have increased alarmingly. Even very young people are getting affected with strokes because of the various complications that result from the COVID infection. And autoimmune diseases, inflammatory diseases, and some of the genetic conditions also can lead to stroke in very young people. The primary thing is that we need to create awareness to see that who all the people at risk will undergo a screening so that to the best extent possible stroke can be avoided. The commonest risk factors are the diabetes is the number one, followed by obesity, snoring, hypertension, and dyslipidemias and other associated medical conditions. Now, snoring is something which is all the time ignored. People who snore have a very high risk of developing stroke. So, it can be diagnosed, treated after doing a proper sleep study. So, it is mandatory that those who are above 40 years, those who have all these diabetes, hypertension, obesity, snoring, high cholesterol, etc., and those who have a family history of stroke have to undergo screening very regularly. So, though risk factors can be identified and they can be controlled. Similarly, once stroke comes, brain stroke, it does not mean that it will not occur again. So, it can occur in a different territory, sometimes in the same vascular territory of the brain, completely causing total disability. So, this can be avoided by following lifestyle, following the proper medication, regular exercise, pranayama, and taking the medicines regularly, and compulsory checkups and keeping all the parameters under control. So, to create this awareness, Brains Super Speciality Hospital is conducting a stroke screening campaign. So, from 25th of October to 15th of November. So, the stroke screening is basically to evaluate the people at risk by doing some basic blood flow tests, Dopplers, and the blood tests, so that if there is an abnormality, they can be put under vigilance with a strict follow-up and probably good medication, and controlling these risk factors will certainly prevent, postpone, or avoid a stroke in the future. Now, once stroke occurs, they need to rush to the hospital, and Brains Hospital is one such stroke centers where treatment can be, all varieties of treatment can be provided under one roof.